All right, thank you, Dr. Roberts. I've had the privilege of knowing him for a number of years, both as a surgeon, as a friend, and as a mentor, and it's been very fruitful. So thank you for having invited me here. So I've titled this "Going to America" for want of a better title. But in a sense, what I'm trying to do is to give you all a view of, a kind of overview of what it's like, what you should be thinking about if you're considering going to the US. I know that all of it may not be relevant to all of y'all because y'all are at different stages of MBBS. Some of y'all may have finished, and it may be repetitive at some point. So bear with me on those parts. So I'm just going to ask you to tell me whether the following are true or false. Just let me know what y'all think. So there's a bunch of statements. Some of them reflect what people seem to think of this whole USMLE business. Okay. First one, the majority of foreign graduate applicants who apply to US residencies get in. True or false?
False.
False. Unanimous. Okay. The odds of getting in have become slimmer. True or false?
True.
True is this way and false is this way. Alright, okay. Having a strong letter of recommendation from a senior Johnite figure could go a long way.
False.
So, false meaning that it does not help you, or does help you. It's helpful. So is it helpful or not, having this letter?
Helpful.
It's helpful, okay. Having American faculty put in a word like on the sly, call people up and say, listen, take this guy. Strictly illegal. Useful or not?
True.
What do you guys think? Useful, alright. The US is strictly objective and merit based when it comes to applications. True or false? False. Okay, that one's unanimous. Alright, so maybe we'll get a better idea of, I mean, some of these things will be answered in the course of this talk. One more. In a given year, you can apply to multiple specialties simultaneously. So you can apply to surgery, medicine, radiology, pathology, all together in one shot. Yes? Alright, good. So before I start, I just want to go through some of the terms that are bandied around when you're applying. I found this to be one of the biggest obstacles because I couldn't figure out what half these terms meant. So I'll run through them quickly. And so the first three are residency. So what's a residency? It's the same as an Indian PG, right? So a residency is varies in length from 3 years to 7 years depending on what you're doing. So a resident is the same as a postgraduate. And they denote years as, so we say first, second and third year, they call them PGY, 1s, 2s, 3s and so forth. PGY stands for postgraduate year 1 and so forth, right? And the senior most person we call the chief resident. A preliminary resident, so can anyone tell me what a prelim is? Okay, actually I won't ask you all to tell me because you won't. Prelim is someone who is taken into a program purely as on a 1-year contract. So you're given year 1 of your post-graduation. Beyond that, there's no guarantee. Okay, so it's up to you to find a placement in a year 2 spot somewhere in the country, or apply as a categorical resident the next year. So what's a categorical resident? A categorical resident is someone who has a contract to complete the entire post-graduation. So in India, everybody is a categorical resident, right? Excuse me. So if you get into a PG in India, no one can throw you out in the middle saying you only have a 1-year contract, right? You finish, unless you really screw up. So that's what a categorical resident is. And within preliminary years, they have what are called designated and non-designated prelims. So is everyone clear on what a prelim is and what a categorical is? A prelim, you're guaranteed only year 1. And it's up to you to find a spot after that. A categorical, you're guaranteed all 3, 5 or 7 years depending on what program, right? So in prelim years, we have what are called designated and non-designated preliminaries. So a designated prelim is someone who does a preliminary year in, say, surgery or in medicine as part of a requirement of whatever specialties they're going into. For example, if you want to go into radiology, you have to do 1 year of prelim, right? So people choose to do it in medicine or surgery or whatever they feel is more interesting to them. So they're called designated prelims because they have something to do after that 1 year. They're going to go on and become radiology residents or pathology residents and so forth. Non-designated prelim is what you will find a lot of foreign medical graduates doing when they first go there, where you just do a 1-year spot, right? So you just have a position for 1 year. Observership, clerkship, externship and USCE. Okay, so USC stands for US Clinical Experience. So any kind of clinical exposure in the US is clubbed under USCE. An observership is, what's an observership? You shadow someone typically when you finish, after you finish medical school, right? You can do it even while you're in medical school. It doesn't mean that you can't do it when you're in medical school, but you're shadowing somebody. A clerkship is when you're still a student. And you go there and you rotate as a medical student in the US. Okay? An externship is somewhere between these two. Usually an externship is done after you finish medical school. Again, you follow someone around and you get to do some kind of menial labor. So you may fill charts or do irrelevant kind of things. So it's not very different from being an observer. So is everyone clear with these terms? FMG, IMG, US IMG and a non-US IMG. So what do these stand for? Foreign medical graduate. What's IMG? International medical graduate. What's the difference between the two?
Nothing.
Absolutely nothing. It's the same. Different people will use different short forms. A US IMG. What's a US IMG?
Citizen studied outside.
Exactly. And a non-US IMG is obviously someone who's not a US citizen. Right. Okay, now what are these? So these are the 6 organizations that you will deal with intimately and be sick of by the time you get in, right? So the first is USMLE. What's the USMLE? The US Medical Licensing Exam. So now this is an organization that basically sets exams. That's their only job. They set exams, your step 1, step 2 and step 3. They run the exams. Everybody who graduates from the US takes these exams. Anybody who wants to be involved in medical care or training in the US has to take these exams. So it's applicable both to American students as well as people who come from outside, right? What is ERAS? Anybody know what?
Residency application service.
So ERAS is a computerized application service. It stands for Electronic Residency Application Service, right? So you register with ERAS, you fill in your application form, which is all online, and you do this on ERAS, and ERAS has a column where you select the programs that you want to apply to. And what ERAS does is, ERAS will send out your application to all these. So gone are the days when all of you all got into MBBS, each form you filled out separately, put it in an envelope and sent it into your respective institute, right? So that's done away with. Imagine you had one place where you could go for your MBBS entrance exams, pick all the different colleges that you wanted to go to, okay, and put it into a computer, and your application is automatically generated. So it makes your life a lot simpler. What's the NRMP?
National Residency Management Service.
Okay, I think for some of you all who are maybe first, second or third years, this may seem like it's an unnecessary detail, but believe me, when you do start reading up about this, it will be helpful. So the NRMP is the National Residency Match Program. So this is a computerized program. It's actually really interesting because the guy who came up with the algorithm for this won the Nobel Prize, right? And its widest application is in online dating services. So I mean, I don't know how many of you guys use that, but as an aside, it's useful information. Okay, so the way NRMP works is, so let's say I went and interviewed at a bunch of programs, right? So I went and interviewed at different programs. At the end of my interview season, I sit and rank the programs that I went to in my order of preference. So let's say you apply the NRMP system to India. So you interviewed at Vellore and St. John's and AFMC and wherever else. So I sit at the end of my interview season and I rank them. Suppose I say my number 1 choice is St. John's, that's rank 1. Then is Vellore, then is Kottayam Medical College, then is, I mean, you get the point, right? And now each of these places have interviewed 200 or 300 candidates, right? So St. John's interviews, say, 200 people each year. So imagine each institute also ranks the people they interview in their order of preference. So for example, you guys are 1, 2, 3, 4 and 5, okay? So those are ranks I assign you. All of this is fed into a computer and you get your best possible match, right? So suppose I rank St. John's 1 and St. John's ranks me as 1. The probability of my matching into St. John's is extremely high, in fact 100%. But if I rank a place 2 and they rank me 4, there's still a good chance that I can match if that's the best possible fit that they could find, right? So it's a very interesting algorithm and it's essentially an organization that runs this whole matching process, okay? The AAMC is the American something Medical Council, okay? The ACGME is the American Council for Graduate Medical Education. So the graduate medical education refers to your residency, so your post-graduation. So these are the guys that will govern what is taught in your residency Are you being taught well in your residency, etc., right? And you have the ECFMG. What's the ECFMG? This is possibly the most important organization of the lot. What's the ECFMG? The FMG is for foreign medical graduate, right? So the Education Commissions for Foreign Medical Graduates. So as a foreign medical graduate, all your credentialing, so which means, how do these guys know that you're actually genuine? There are multiple bogus medical programs and medical schools all over the world, right? So how do people in the US know that you are genuine? Through the ECFMG. So the ECFMG will contact your medical school, make sure that they get your marks cards, make sure they get, all the information from medical school and certify you saying you finished your MBBS from this place and you are eligible for studying further. Okay, so that's the ECFMG. I'm going to leave these two. The next question I think that a lot of you all are going to be facing, especially some of the more junior people, is where do you want to train? Now I think this can be a decision that's fairly straightforward for some people. For some people it's a very difficult decision. A lot of it depends on what your priorities are. But I think maybe there are some things that may help you do this. The earlier you make the decision, the better, because obviously it gives you more time to think about how you want to go about applying, get yourself in order for the process. But it's better to do it late than later, right? It's better to do it in internship than to do it in year 2 of your bond, where you've already been studying Indian entrance books for a year. So try and get it done early, but if you haven't decided by internship, it's not the end of the world. Plenty of people decide during internship, right? And this is what I believe you should do. Follow a what, where, and then when sequence, right? I think the most important thing when you're going into a residency or going into a PG is to decide what is it that you want to do. Don't base your decision on where you want to train and then settle for whatever field you can get in. Because this is something you're going to be doing for the rest of your life, right? So if you can decide, and if you know in your head that you want to be a surgeon, stick to that, right? And make sure that you work as hard as you can and do what it takes to get into surgery. And don't be prepared to settle. Just because you want to go to the US, don't settle for something that you're not going to be happy doing for the rest of your life. So make that decision and then decide where you want to go. So for a lot of people, again, in first year, they're already clear about what they want to do in life. Some people are uncertain by the time, even when they finish medical school. So try and make that decision and then decide where you want to go. And where you, the coming slides, I think, will tell you a little bit more about trying to decide where you want to go. And then decide when it is that you want to go. So set a deadline for when you want to apply, right? So some of you guys in 3rd and 4th year, it will probably be 2017 is what you're targeting. So once you have that in mind, then you can work backwards and then you can figure out a timeline so that you know roughly when you need to start preparing and getting your things in order. Because this is a long process, right? This application process runs for a year. Basically takes a year. So you need to be prepared at least 2 years in advance so that you can do the right things at the right time. Okay? And make an informed rather than an emotional decision. America isn't Hollywood and Manhattan. It really isn't. So, don't watch Gossip Girl and whatever else and decide that that's the place that you want to be because that isn't real life, right? Some of you may think that it is, but it isn't. And so make an informed decision. So talk to people, read. There's plenty of material to read. Contact people that have been through the process and try and get as much input as you possibly can before you make a decision. And don't look back when you're fully invested. I met multiple people on the interview trail. So I was interviewing for a period of about 2 or 3 months, and at each interview you meet a different bunch of people, right? And a different bunch of struggling foreign graduates. And you meet so many people that are sitting and thinking about whether they should have done this or not, or whether they should go back, and what entrance exam they should be giving. And I think it's really not fruitful. Once you've decided that you're going to do this, you spent a whole lot of money obviously getting to this point. Don't look back. Give it everything. It's a different matter if it doesn't work out for 2 or 3 successive years and then you need to have a plan B. But don't start off by having doubts. Okay? Now why the US? So how many of you here have decided that you want to go to the US? Okay. Alright, and why do you want to go? Give me one reason why you want to go. In your head, like why do you want to go?
relatives are there. So
Most of your relatives are there. All right, that's not on my slide, but maybe it should be. A lot of relatives are there. That's a fair point. What about you?
I like the concept of the system very well. I like that you probably get more hands-on experience. And I'm not more hands-on. You get more hands-on experience here, but
Okay.
you'd be forced to learn more integrated.
All right. Okay. Chan, what about
System
you?
of education, sadly to say, is a little more superior than India.
The system of education meaning the.
The
What do you mean?
structure,
It's structured. You're saying it's structured. All right. Fair point.
All said and done, it is medically advanced more than India.
You mean they're more cutting edge than they're more.
They're more cutting edge and they train their students to be more cutting edge.
Fair point. What about you?
See, in the system of education, the method.
You can't say the same. You have to come up with a new point.
That's what I decided, sir.
All right. Anybody else decided? No. Okay. So that's a whole lot of reasons, right? Just from 5 people here have 4 people have different reasons for why they want to go to the US. Cutting edge science is the first point on my list. I was fascinated by
One reason, because I'm also writing the exam.
It's,
It's,
which just proves that there's no age. Age is absolutely no bar.
thank you. You just made me feel very, very old.
To write
Yeah, but I
exam.
think it will come to a phase where I've seen the Indian system, I've worked through the Indian system and seen the best of places, and I'm happy with it. But it's one life. I just want to see how that system works. See the world. And like someone said, it's a very different system from ours. So, and because it's one chance, I think we want to go into it. So, I think everyone who wants to go to the US is a little.
Quite possible. I mean, there are plenty of reasons not to go as well. We'll come to that. Cutting edge science, I don't need to go into more detail about it. They don't mind spending as much money and whatever it takes for the patient, right? They have like 92-year-olds who are diabetic, hypertensive, have vascular disease, have had 2 strokes, are obese, don't have a family, don't have a reason to live, who are depressed, and they'll be doing like liver, pancreas, something transplant. And you're sitting and wondering, what the hell are these people doing? But if it's for that guy and he really wants to live, they do what it takes. You can say that it's irrational and it's a lot of resources that are being spent poorly, but at the end of the day, purely in terms of science, they are advanced, right? It's organized, systematic, and evidence-based. Okay. These are all opinions. Obviously, I don't want people coming back and saying, "How dare you say India is not organized and systematic?" This is just, I can only give you my opinion, right? Because this is my talk, so I get to give you my opinion. So I think it's an organized and systematic place. Your degree is accepted worldwide, which is not something, it didn't strike me as being important till I went there this time, and I was like, what do I want to do with my life? Do I want to sit in a private practice somewhere and do the same thing for 40 years? Possible. A lot of people settle for doing that, but I think I'm more inclined to go around the world and maybe work in different places, and this just gives you the ability to do that, right? It opens so many doors, which is a nice thing to have. Research, mentorship, and networking. Research is absolutely essential to being. If you want to be an academic, if you want to be in a university in the US, you have to have research. They're more bothered about research than they are about your clinical skills. Okay. I mean, you could be cutting arteries into left, right, and center, but if you have papers, if you're churning papers out, they will keep you on tenure. But you could be the most skillful surgeon with no research experience whatsoever and is not contributing research-wise, and you may not be valued as highly. So it's an interesting place to be if you want to do research and want to get involved in it. And you find a lot of good research mentors. There are senior people that will take you on, train you in research, and help you. And I think that system is very important. Also, you build up these networks. You go to the same meetings. You start seeing the same people over and over again. You exchange ideas. You collaborate on projects. And I think networking is very, very powerful. Later on, when you need some help or you have an idea that needs expertise in a particular area, you always have this backup, right? Money and lifestyle. I mean, this is both they're both on my why to go to the US and why not to go. I think the money in the US is overrated. I think the lifestyle is overrated personally. But some people like the glitz and the glamour. You can be in Broadway in the night and be in Bermuda the next morning and doing all this. But if that's your priority, well, I mean, fair enough. So you've got to decide whether those are things that are important for you. And if they are, it's a great place to be. Exposure. I won't repeat what Dr. Roberts said. Dignity of labor, I think, in being in the US. You generally don't get treated like crap. It happens, especially in the Northeast. So if you go to places like New York or New Jersey, parts of Connecticut, they have a more aggressive, more what they call a malignant system. It's a bit more like India. But in general, you're treated as a professional, you're not treated as a student, and you don't learn because you're scared of what someone's going to say or someone's going to do in general. Why not the US? It's a tedious application process, and it's not a merit-based application process. It is not. You could be a great student and not get in. That's the reality of it. The uncertainty around the whole application. I'm facing it right now, right? I find out next month whether I've gotten in or not. So I basically got 2 months where I don't know whether the last 1.5 years of effort is going to mean anything. So there is that uncertainty, and there is a possibility, statistically there's a possibility that you won't get in, right? And you have to be willing to face that, and you have to be willing to accept that. The long training period, particularly in surgery. So if I was to get in for some of the programs that I really liked are 5 years of surgery and usually 1 or 2 years of research. So you're talking about a 7-year program to be a general surgeon, right? Which is a long haul. Lack of family and social support for many people. You're in an alien environment, and some people, I guess, assimilate quickly and some people don't. So this can be a pro and a con. Reliance on ancillary services in lieu of clinical acumen. Now this is something that I think is changing in India too. We talk about how good Indian physicians are with clinical examination and on basing decisions on clinical grounds, which is excellent, and there's no doubt that they're superior here. But I think that's something that's going to change as you get more and more investigations coming into day-to-day practice. It is something that's going to change. The legal climate, especially if you're doing pediatrics, obstetrics, surgery, people sue you for absolutely anything. So it's not unusual for a doctor to have a lawsuit every couple of years filed against him for malpractice or negligence, and so this is something that you're always dealing with, right? Money, lifestyle, again, it's not all that's made out to be. The chairman of surgery where I was doing my research would be he was on his 3rd marriage. He would be at rounds at 4:45. The chairman would be there at 4:45. So the chief resident would be there at like 3:45, and the junior most guy would have to be there at 3, and the guy would work till God knows when. So when you see people like that are completely single-minded about their work and don't have much of work-life balance, you wonder whether this is all actually worth it, right? And opportunities for a spouse or significant other. This is a problem that I saw. There are a lot of married people that I met on the interview trail, and a lot of them had wives or long-term girlfriends. They weren't sure where they were going to be, what they were going to do. So I think this is something that will play on people's minds. Visa issues. Alright, so I think I'm taking quite a long time, so I'm going to run by some of these slides. Just quickly, 36.8% of all the people who applied last year were foreign medical graduates, right? So that's the so these are all. I didn't make this up. This is data from the NRMP, so the National Residency Match program. So they put out a bulletin after each year's match, telling you all the statistics, and it's a fantastic resource if as you are going through this process. Okay, so that's a significant number, right? So that's more than 1 in every 3 applicants are from outside the US. And if you look at it historically, so it's a bit blurred, but that's 1952 on the bottom left, okay, going up to 2010. And the green line tells you the total applicants, and the red line tells you the total number of PGY1, which is postgraduate year 1 positions. Okay, the positions have increased. The people applying have increased even more. That's pretty evident from that graph. And you can see it's really interesting that there are peaks, and I think what happens is that people look at it and say it's become really difficult. It drops off for a few years before it goes up again. So I mean, maybe it's like it's reached the crest now. It may come down. I don't know, but this is just another statistic. The country of medical school, you can see India by far contributes the largest number. right? Not surprising. So, by far, and I mean, who comes second? Pakistan, right?
Really?
And, yeah, a lot of Pakistani physicians.
Wow.
I interviewed, one of my interview days, there were 3 brothers from Pakistan, all interviewing for surgery. And they were pretending not to be related, which is difficult. This is quite funny. But Pakistan, Nigeria sends quite a few, China has a few. But you can see that, so you're not from a very favorable demographic when you interview, right? Because they see a lot of Indians, so it's not like it's something unique. It's not like seeing someone from, I don't know, Lesotho or Somalia or something. Every other person is Indian. And you can see that 750 matched and 1,200 didn't match. Okay, so it's about, I don't know, what is that?
What is the
Yeah, something like that. This is just quickly the number of IMG applicants and positions in the 2013 match. Okay, you can see that the majority of people apply for medicine, for pediatrics, for family medicine. Some for emergency medicine, some for surgery, psychiatry. Okay, these are. Okay, this is an important slide. So this is a summary of all the statistics. This is purely for foreign medical graduates. Okay. Now, if you look at the 2 columns, one is for a US IMG and one is for a non-US IMG. I don't think that's the important distinction to make, because all of you all, for the most part, everybody is a non-US IMG, right? If you look at who has matched and who hasn't matched, and you look at what are the factors that help you get matched, you can see that there's a significant difference in your step 1 score between people who've matched and who haven't, both in step 1 and in step 2. You can see that the other things that really are in your favor is the number of years since graduation. There are a lot of people that apply after finishing your MS, you work for 2-3 years, and then you decide to go to the US to do your residency again, and they don't look on that favorably at all. So the further you are out from medical school, the less chance you have of getting in, right? And so I would say, so those are the important things I think to take from this slide. And the mean number of contiguous ranks, which means the number of places that you've interviewed at and ranked. Remember I was telling you about the ranking on the NRMP? So the more places you rank, the higher the chance of matching. Right, is what the slide is basically saying. So I think this gives you a lot of very, very useful information on what to expect. So what should your priorities be? I think why it's important to talk about this is that I get emails from people who are obsessed with clerkships and about the various nuances of clerkships and how many weeks they should be doing, and I ask them, listen, so what's your step 1 score? Or have you done your step 1? And they're like, yeah, I mean, I'm going to get around to it. And I just look at them and think, what on earth are they doing? The single most important thing that you can do is to do well on your step 1. Anything else is a bonus. Anything else that you can get is a bonus. So don't lose sight of that. Don't lose sight of the fact that your step 1 score is the single most important thing for you to get. Okay? So now these are some very interesting papers that have been published in the last few years, generally in journals of education, where they've sent out surveys to different program directors. Program director is the guy in charge of a residency program, right? In charge of recruitment. So they asked, what are the factors that really play a part in selecting a candidate, right? And if you look at it, interview performance naturally, once you go to the interview, it's how you perform. Your clinical course grades, letters of recommendation, and your board scores. Okay? I'll clarify why the board scores are 4th on this list. Remember, this is now telling you what is important in getting into a residency. Okay? Not being called for an interview. Now there's 2 separate things that we're talking about. One is the first step is to be called for an interview. So there are certain things that are important in being called for an interview. Okay, once you get to that interview, then there are a certain set of criteria that are important to actually get in. Right? And again, another article in the Journal of Surgical Education says interview is by far the most important, followed by your step 1 score. Right? Again, interview, USMLE, and letters of recommendation. So you can see that there's a pattern here. And if you look at the NRMP conducted a survey in 2012 of all the program directors, and they give you the percentage of programs citing each factor in selecting applicants to interview. Okay, so when you apply to a program, from 1,000 applicants, they have to narrow it down to about 200 to interview, right? So what criteria do they use in selecting those 200? And what's important? Your USMLE step 1 score is by far the most important thing. If you have a really high score, often they don't even look at anything else, they will call you for an interview, which is not to guarantee that you will get in, okay, but you will be called for an interview. Letters of recommendation in the specialty, extremely, extremely important, because it's like an old boys club in the US really. They're all members of the same associations, they all meet, they all know each other. So you see a letter from someone you trained with or someone you met at this meeting and you know that they're reputable people. And if they're backing you with a letter, then you're probably a good student, right? Personal statement, I'll come to that a little bit later. Grades and required clerkships, so which is basically grades in your required rotation. So if you want to do surgery, when you're a 3rd and 4th year student, how well you did in your surgery rotation. I guess a bit like your end of posting exam or whatever, how well you did on those. And your USMLE step 2 score. It's not as important in being selected for an interview. So your step 1 score is by far the most important thing. Yeah? Now these are some of the things that come further down. You can see your class ranking is pretty low down. Okay, so you may be number 1 for a number of years, but it doesn't matter all that much. Now this slide tells you what gets you in. Now once you have reached the interview stage, what are the factors what are they looking for, right? What are they looking for in the 200 people that they're interviewing? Who really stands out, and on what basis are they selecting people for their program? So if the applicant was flagged with match violation by the NRMP, which basically means that you were up to no good in the application process somewhere, you're obviously going to be out, right? Interaction with the faculty during your interview, interpersonal skills, extremely important for FMGs because you have a lot of people who come in for whom English is not a first language, right? And for them, interpersonal skills may be a problem, which is why it's ranked so highly. And the rest of the stuff you can see. Your USMLE step 1 score is not as important at this level. So I think what you can take away from these slides is that your step 1 score gets you the interview. Once you get to the interview, it's more of a level playing field, right? Because once you get to the interview, what matters is the quality of your interaction with the people who are interviewing you. Okay, so once you do get called for an interview, they're not going to interview people who they're not seriously considering for a position. So it's a really great thing to be called for an interview, okay? And these are just some of the other things that play on people's minds. Okay, so when you're looking at your priorities, right? If you're sitting down now and saying, listen, I'm going to be trying for the 2017 match. What are the things that are really in my control, right? What can I do to maximize the few things that are going to help me? And your USMLE step 1 and step 2 scores are the single most important things, and it's completely in your hands, right? So these are the first 2 things that you should be bothered about. What else can you do? Pass the clinical skills exam in one shot. For those of you who don't know, the USMLE step 2 exam is divided into 2 parts, right? There's a clinical knowledge, the CK, which is just another written exam, and your clinical skills, which is like a practical exam. And a lot of people fail the clinical skills exam. A lot of people fail it. And taking the exam more than once is considered is quite a red flag on your application. So make sure you pass that in one shot. If you do any US clinical rotations, make sure that you do exceedingly well in them. Do whatever it takes to get noticed. Okay, if you need to suck up to people, suck up to people. Okay, I don't think you should be worried about being modest and being self-effacing in these kind of situations. You need to do what you can to get yourself noticed and to make sure that people recognize your relative merit. Okay, and when you are in your rotation, do all it takes to get strong letters. So if you're on a rotation, select 1 or 2 faculty maybe who you think are important and are nice, approachable people and who you think will write you good letters. Make sure that you try and get as much face time with them as possible. So for example, in surgery, if I was to be posted in a particular unit with 6 surgeons, I would select 1 or 2 surgeons who I think are nice guys and who maybe I struck some kind of rapport with. I would follow them around, try and get to know them, talk to them about football or whatever it is to try and get pally with them. So then you can try and get a letter out of them. Okay, strategic in this. And a flawless and engaging personal statement. I'm sorry, that sounds terrible, but that is what it should be. Your personal statement is something that you write about your life and about why you're applying to surgery. And it's a place where you can really impress people if you have a well-written one. So you should work really hard on making yours as good as possible. In college, do as much as you possibly can. St. John's gives you a lot of opportunities. And you get a lot more opportunities here than you do in most other places in the country, if not in most parts of the developing world. So try and get stuff on your CV. Because anything on your CV puts you one step ahead of the other FMG who you're competing with. It's sad, but true. And anything that stands out, right? Anything that you can, if you're a champion swimmer or if you're, I don't know, anything that can really stand out puts you in good stead. What's beyond your control? The fact that you're an IMG and that the system is unfair. You are an IMG at the end of the day and the system is unfair. There is no point cribbing about it. You will meet multiple people that will tell you how sad their life is and how many people have rejected them. I've done the same. I had so many rejection letters that I was sitting and calling people and telling them what an unfair system this is and how horrible it is. It is absolutely not to your benefit, okay? So don't do it. Arbitrary rejections. People will reject your application for no reason whatsoever. Absolutely no reason you will get rejected. It just happens. And once you're done with your step scores, stop worrying about them, right? You give it all you can when you're studying. And once you're done with it, you can't change it. So you work with what you have, right? And try and concentrate on things that you can do to beef up your application. Maybe if your step 1 score isn't as good as you thought it ought to be, work hard for step 2. If they see an exceptional step 2 score and they look at your step 1 score, they'll say maybe, this guy had a bad day, or at least he's improved, or, it gives them a better picture of you. And these are some things that I find are ineffective strategies, and I've seen people, a lot of people spend time and energy on doing this when it's not very effective. US clinical exposure for the sake of it. Saying that you did a 2-month rotation in a US hospital on your CV, when it comes down to it, means nothing to them. It means absolutely nothing. The purpose of doing a US clinical rotation should be to get letters of recommendation. That is your primary aim. I did a 6-week clerkship when I was in final year. I had no idea about any of this. I went there, I kind of hung around. I thought that getting 6-week clerkship in the US on my CV would be really impressive. And people would be like, wow, this guy came here, he did a clerkship, and there are so many people who haven't done clerkship, so let's give him a spot. It doesn't work that way. The only reason you're going there to do your clerkship is to get good letters of recommendation from faculty. The other is to get to know people in that program, so that when you apply to that program, if they see that you're smart, there's a chance that you can be called for an interview there. So those are your 2 aims when you're going to the US for clinical experience. It's for letters of recommendation, and it's to maybe try and work your way into that program. It is not to get, I have completed a 6-week clerkship on your CV. Targeting research experience with no publications or letters. Again, if you're going to do 6 weeks of research somewhere, if you don't have a publication at the end of it, and the guy who you're working with just hasn't given you a letter, it's fairly useless. Continual postponing of the USMLE in order to do a little better. I have a friend who started studying for USMLE with me. He still hasn't taken it. Okay, so he's been studying for it for 1.5 years now. And each time the date comes around, he pushes it by another month, saying that he can do a little bit better. I firmly believe that you reach a peak when you're studying, beyond which any additional studying is balanced out by stuff that you're forgetting. So I think you reach a certain level where beyond which I don't think you can do much better. So set a date for yourself, set a reasonable date, and stick to it. Do not postpone. Because you will get last minute jitters, you will do all these mock exams, some of them may not go as well as you hope they would, and you will be tempted to postpone. Don't do it, okay? Spending hours on forums discussing doomsday. Any number of, just Google USMLE forum, and there'll be these guys with such pathetic stories talking about how unfair the system is, okay? Just avoid them because you get depressed. Alright, matching in your step 1 score. This is just in addition, this is just to prove prove to you how important your step 1 is, okay? You have your step scores on this axis and you have your probability of matching. So 1 being 100%, right? So if you look at it, if your score is 220, your probability of matching as a, let's just take the green line, the non-US IMG is 40%. If you are at a 260, you're automatically up to above 80%. Okay, so this is quite a, you can see how important your step 1 score is.
Yeah. Gopal, can you stop you there?
Yeah.
There is one specific question from a journalist who says that I've scored 220 on my step 1. Should I just give up the USMLE process, or is there hope?
So that's not a question that, I mean, I can't tell this person what to do. What you have to do is look at the statistics, and if you are at 220, you have a 40% chance of matching. If your step 2 score is also 220, again it remains around 40%. But what you can do is do really well on step 2. If you can push your step 2 score up to maybe 250 or 260, then your probability will increase. So that's what I would say. And these are some of the average scores in different specialties. Okay. So if you look at it, the ones with really high scores are radiology, general surgery. I was actually surprised by the statistic. Surgeons are renowned for not being cerebral, but this is a high score.
There's just no respect in this world.
This is a pretty high score for surgery, right? And if you look at medicine is high. Family medicine somehow doesn't get the cream of the crop, as you can see, right? So again, this is just something that I don't read too much into this, but just purely for your interest, right? What specialty? Comparative specialties are, yeah, you can. I'm sure most of you guys know all this, right? What's comparative and what's not? What's not comparative, relatively, is medicine, psychiatry, family medicine, obstetrics, and pediatrics. Those are the 5 that most FMGs target and most FMGs get into. Can you apply to more than one specialty in a year? Yes. And is it advisable? No. If people find out that you've applied to medicine, surgery, emergency medicine, and psychiatry in the same year, they say this guy is flaky. He obviously doesn't know what he really wants to do in life, and he's kind of trying to, what's the term? Spread his eggs. Spread his eggs.
Spread it thin.
Put his eggs in different baskets, right? So this kind of gives you an idea of what to target. But like I said, I think your decision should be based on what your interest is and not looking at this too much. I suppose you could look at this if you're one of those people who's indecisive and doesn't mind doing medicine, surgery, psychiatry. There are people like that. And going to the US, I guess, is easier for people who are like that. But I mean, I can't think of doing anything else than surgery. And so for me, I had decided that I wanted to do surgery a long time ago. And looking at statistics was not going to change what I was applying for. So I would strongly recommend that you find something that you're really interested in and stick to that. Yeah, so a few people had asked about the timeline, right? How you should go about planning what you're going to do, and when you're going to give your, what year you're planning on matching. So decide your target match year and you work backwards. So I've just given you my timeline, what I did, right? So I decided that I was going to try for the 2014 match. Okay, so we're in 2014 now. 2014 match means that your match results come out in March. You find out in March where you've gotten in and you start on July 1st, right? So that's the 2014 match. So obviously the work for that starts in 2013. So register with the ECFMG. Oh, actually that's September 2012. I'm sorry, that's a mistake. So I registered with the ECFMG in September of 2012. Okay. So you register with the ECFMG, and like I said earlier, they will send a whole lot of documents. They'll ask for a whole lot of documents to be sent from the student section to them to verify that you're actually a student and you've completed this stuff. This takes a little while. And so once you're done with that, apply for step 1 and do step 1. So I did step 1 in December of 2012. Okay, so I applied around September for ECFMG certification. Did my step 1 in December of 2012. I would say, anywhere between 3 and 6 months of preparation. Okay, depending on the person and how you study, and there's a lot of variability. But I think I spent about between 3 and 4 months. So that's step 1. Schedule step 2, CS. CS is clinical skills, which is the practical exam. You can only do that exam in the US. You can't do that in India. So schedule that early because the slots for that are limited and they tend to fill up, right? So schedule it early. You can schedule it well in advance, right? And then sit down and study for your step 2, CK, which is your clinical knowledge, which is your written exam. It's a much easier exam than step 1. Step 2 is far easier. You should do better and it should take you less time to study. And yeah, make sure you finish your step 2 CS as early as you can. Once you finish your step 2 CS and CK, you can apply for ECFMG certification. So ECFMG certification, ECFMG is the body that certifies all foreign graduates. So once you have these 3 scores, you can send them into ECFMG and ECFMG will give you a nice big white certificate that says that you are now eligible for applying in the US. You can now register for the match, okay? So I had finished step 2 CS in May and step 2 CK also in May. I did both within a week of each other. I'm sorry, my dates are all screwed up on this. Fly to the US for step 2 CS. Once the results are out, apply for the ECFMG certification. It typically takes 6 to 8 weeks for the certificate to come through. Okay. Now in the interim, you should start working on compiling your application. So your personal statement takes a while to write. Make sure that your CV is professional. Start looking at different programs. Start looking at different colleges. Okay. And approach people who are going to write you your letters of recommendation. Okay. And you need to do that early because doctors are notoriously fickle when it comes to these things. So you got to go after people sometimes. Some people are really nice about them, some people aren't. So make sure that you go after the people that you want letter of recommendation from. Okay, and you register with, okay, actually I'm going to skip this bit because it's not relevant to most of you all. For a couple of you all that are actually going to be going into the match soon, I'll talk to you all about it. But essentially you register with ERAS, you send out your applications, you interview, and then you draw up your match list. Which is what I told you, right? You rank the programs that you interviewed at, you put all the stuff goes into a computer and you get your best possible match. Okay? How can you improve your chances and early decisions? Start working on research. Apply for every single scholarship that's available. What's the worst that can happen is that you'll be rejected, right? Absolutely nothing to be lost. Use clerkships to your advantage. If you are going to do a clerkship, remember that what are the goals of your clerkship? What's the main thing? A letter of recommendation, right? And the second is to try and work your way into that program. So don't forget that. Establish and maintain all connections. We Indians are terrible at doing this. I am terrible at doing this. So you meet people all over the place and Americans actually expect you to keep in touch. They actually want to be informed of what you're up to, what your plans are. It can just be a one-line email. Sometimes they won't respond. Sometimes they'll respond with an okay. But that's all they expect. So they expect you to email them when you have your step 1 score. They expect you to email them your plans to keep them in the loop, right? Which is something that we're really bad at doing. So make sure you do that. Don't be disheartened by rejections, okay? You're going to get a lot of them. Don't get like depressed and suicidal or whatever. It's just part of the system. Okay, I'm going to skip the stuff about the USMLE clerkships. So if you are going to do a clerk, so is everybody clear on clerkships? Do you all want me to go through this? Yes? No?
Yes.
Yes. Okay. So clerkship has to be done before you finish medical school, right? It usually involves paying a fee. So you pay, typically whatever a medical student in the US is paying for their rotation, you pay. Unless you go through, when you go to Minnesota, do you pay? No. So that's a great thing about going through St. John's, right? Is that the fees for the clerkship are waived. So that's a really great opportunity that you guys have. But if you arrange a clerkship on your own, you typically have to pay something for it. So you are rotate as a student. So you are exactly like an American student. You can take cases, you can write up histories, you can examine patients. So obviously you're a lot more part of the team. Okay. It's not very useful just to write that you've done a clerkship. Remember that you're there for the letters and you're there to work yourself into the program. I cannot stress this enough because I made this mistake. Okay. And observership is where you tail someone around. You're not allowed to have any kind of interaction with the patient. You generally don't write orders. You don't do any of the things that a medical student does. You just kind of shadow people around. But it's more difficult to impress people and get involved in the team, right? Because you're an outsider. But if you do manage to have a faculty, if you're tailing somebody who's nice and says, listen, this guy is smart and he's hardworking, he's always here on time, he's a nice guy, let me give him a break and help him out and let me give him a good letter. It happens, right? So it can be very, very useful. Okay, and offer to do case studies or case reports, stuff like that, to try and get more face time with them. Your personal statement. So it's the only element of your application that is completely in your control, right? You can revise it, you can edit it. It's not like step one where you go write your exam in a day and then you don't have another chance. You can do your personal statement 10 times over, 20 times over. I must have done mine. I mean, I was so sick of reading it by the time I finished because I had gone through it time and time again. Different people had edited it. But that's what you need to do because this is a place where you can really show them that one is that you know how to write, you can communicate well, and that you have an interesting story. So make sure that you write this without making it too long and dramatic. Do not plagiarize. Indians and generally foreign medical graduates are renowned for plagiarism. Plagiarism is very easy to detect now with like the new software. Have any of you guys used it? So there's software like there's a website called Grammarly, Grammarly. So you can put your stuff there and they have a plagiarism checker. Just scan it on that and it will tell you exactly where you lifted what phrase from. So you will be caught if you plagiarize. So don't plagiarize. Don't make it a biography. Some people start saying, I was born in 1987 in whatever, my childhood was this. Don't do that, people don't care. Have it read by multiple people, have it edited by multiple people. Don't get offended if people say that your personal statement is rubbish, rewrite it. Because people will say that. They have a right to say that and often they're right. I mean, sometimes what you've written is just not good and you have to rewrite it, right? But you have the opportunity to rewrite it, so take it as a good thing. Letters of recommendation. Only letters of recommendation from US-based physicians are given any credence. Now remember that was on the first slide, the true or false. Having a letter from St. John's means nothing. Means absolutely nothing. Is it better than having no letter at all? Yes. Is it having a letter from the Dean of St. John's versus a lecturer from the US, which is better? Lecturer from the US. Sad but true. Okay. Academic or university-based faculty letters carry more weight. Some people go to... Do you have a question? Yeah.
I have a friend's uncle who is a psychiatrist in the US. If suppose he gave a letter because he was a foreign medical graduate,
Yeah.
Would that make a difference? He's in the national review.
Do you want to do psychiatry?
Yeah.
And are you going to go spend time working with him?
Hopefully.
Yeah, because if he gives you a letter based on what basis is he recommending you? So if he says, this guy was here for 8 weeks, worked with me, and blah, 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 he is excellent, then it makes sense. But just giving you a letter of recommendation wouldn't help. But yes, he is a US-based physician. Doesn't matter if he's an FMG or not.
Yeah.
So that definitely helps. Having an academic or university-based faculty writing you a letter is much more useful than going to a small private practice kind of place, following a physician around and getting a letter. Because everybody in these universities goes to the same meetings, they all know each other. It's funny what a small world it is, because they will all know each other. When I was interviewing at different places, people would read my letter and say, oh yeah, I trained with this guy, or I did this with them. It's so funny how all these people know each other. Americans like superlatives. Okay, Americans tend to be brash, they are not modest, they are not self-effacing, and they do not respect these qualities. Okay, we tend to be there, you go there and say, I'm like a guy who's like a 100-meter world-class runner would say, I'm pretty fast, like I'm quite good. Is the way like an Indian would say it. They don't respect that at all. They expect you to come there and say, listen, I'm the best, the fastest. Like you've heard, I don't know if you guys watch NBA or you've heard the guys talk, right? They all come out and say, listen, I'm the best. That's what they expect you to do. And they actually respect that. So being understated, modest, and all that really doesn't work. A strong letter should have a personal touch, right? And if your letter, the person who's writing your letter should really, in that letter, it should come through the fact that he knows you, spent time with you, knows you at a personal level. Okay. And it's a small network of people. Okay, people know people. Pay very close attention to the wording of letters. Okay, so I'm going to show you. I want you guys to read this. Okay, I'll give you all. Yeah.
Waive your letter recommendation or not?
Absolutely yes. I'll come back to that. Okay. Pay very close attention to the wording of a letter of recommendation. Okay, can you guys? Do you want me to read this aloud, or will you all read it?
I think you read it because it'll score on.
Okay. All right. So. It's my pleasure to write on behalf of Gopal Menon, a medical student from Bangalore, India, who completed a rotation on the pancreas and biliary service at the University of Florida. I interacted with Mr. Menon on multiple occasions so I can adequately assess his skill set. Okay? He has a good function of knowledge and likewise met expectations for patient care. He was always attentive to his patients, developed an outstanding rapport with them. He was eager to participate in the care of many patients and actively sought opportunities to learn. In the operating room, he was able to readily correlate operative findings with his medical knowledge, and when questioned, he could articulate surgical management options. His psychomotor skills were as expected for a trainee. Personally, he integrated well into the team and was easy to engage. He is bright, articulate, and clearly wants to succeed. Okay? In summary, Mr. Menon performed admirably on the pancreas and biliary service, and I anticipate that he will continue to learn and be an excellent lifelong student. Okay, so what do you guys think of this letter? Huh?
Generic.
Is it a good letter or not? No? What?
It just changed your
It's like a
name.
copy paste.
It just changed the name.
Okay, so I got this letter for the clerkship that I went in Florida, and I thought this was a fantastic letter when I got it read. It is a lousy letter of recommendation. Okay, so this is the kind of letter that a person will write you if they do not know you, and if they're kind of cornered into writing you a letter. They have to write something. They have a template in which they change people's names. And if you notice, so I had guys who are good at this, read my letters. So words like were as expected. Okay, these are red flags. Okay, the minute you see the word as expected, they can't say his psychomotor skills were terrible. Okay, they can't say that in a letter of recommendation. People aren't that mean. But what they do, they give you code words like this. They were as expected. Okay, easy to engage. I mean, there are multiple examples of this. Okay, so this is a bad letter of recommendation, and it is better not to have a letter of recommendation than to go submit a letter like this. Okay, thankfully I didn't submit this letter because someone pointed it out to me. But this is not a good letter of recommendation. Actually, my next letter is a good one, but I'm not sure I should share it with you. I'm a bit embarrassed. So maybe if some of you guys are interested, I'll show you all later. So pay very close attention to the wording of letters. Okay, and it's better not to have a letter at all than to have a lukewarm letter. This last point: what if you waive the right to see your letter? Okay, so now when you're choosing, when you request letters of recommendation, right? So suppose I'm asking a professor for a letter of recommendation. So I give them my CV, I give them my personal statement, I give them all the things that they need to write a letter, and I have two choices at this point. I can choose for them to give me my letter, and I can upload it myself to. I can put it in my application myself, or I can waive my right to see it. Okay, which means that the person who I've requested the letter from will upload the letter himself. Okay, so now this is a bit of a lottery, right? Because you have no idea what the guy has written. So what they're trying to do is they want you to get letters from people who you are confident really know you, and they don't want you to get letters from 10 or 15 people and then screen them out, select 2 or 3 of the best ones and give them in. Okay? So if you do, your letters are counted, are given much more credence if you waive the right to see them. So always choose to waive the right to see them. Okay? So this is my good letter, which maybe some of you guys can see later. Another of the questions was about the costs involved. Can be depressing, okay, but so is paying 1 year of PG fees in India, right? What does it cost to be a postgraduate in St. John's?
15 lakhs.
2 lakhs per
2.8
per term.
50 pounds.
That's as a UG.
PG.
As a PG.
4.5 per year.
2.8 per term.
2.8 per term. So what is that? Say 6 lakhs per year?
It's about 4.5 to 5.
5. And then you pay for hostel and blah blah blah, right? So let's say 5 lakhs a year. So in dollars, what is that? Eight and a half, $9,000 depending on the year and whatever. Yeah. So that's what you're spending in a year here, right? How well are you treated? Not very well, right? And how much do you get paid once you're in? 10,000. Which is kind of ridiculous, right? That you pay 5 lakhs in fees and then you get a stipend. So put all these things together, okay? And like keep this in the back of your mind when you look at the costs involved. Be prepared to spend between $5,000 and $10,000 on the entire process, okay? There's a paper that says the average FMG spends $4,000, but I don't buy that. I think it's costs a lot more than that. So be prepared to spend between $5,000 and $10,000 on it. Do you guys want the breakup of what costs what? Yes? Alright, major expenses, flight tickets. It's roughly $1,000 for a round trip ticket to the US, right? USMLE exams about $1,000 for each step. Step 1, Step 2 CS and Step 2 CK. ERAS application. So ERAS is what is ERAS? Let's see who's listening, huh? The electronic residency application system, right? So for each application that you send out, you spend some money. The way it works is for the first 10 applications, it's $10 per application. For the next 10, it's $15 per application. So actually the more applications you send, the more expensive they make it. Not the other way around, like you would think. Because they don't want people just apply to apply to every single program. So if you apply to 100 programs, it works out to around $2,500 to apply. Okay, so that's another big expense. Interviewing, it costs roughly $400 for each interview. So each interview you go to, you've got to fly there, you've got to stay in a hotel, you have to rent a car, and you have to eat if that's a priority, or drink if that's a priority, right? So it comes to roughly $400 per interview. So overall between $5,000 and $10,000. Many clerkships charge a fee. So again, depending on whether you're doing a clerkship that costs money or not. If you are doing a clerkship, obviously you're flying up and down, you have to stay somewhere, the added expenses of that. A credit card and a local cell phone you have to have, right? You have to, absolutely have to have a credit card and a local cell phone. The great thing about the US is that if you do have a credit card and a local cell phone, you can pretty much do anything, right? I mean, it's like you have this unbelievable amount of freedom once you have the two of them. Don't be disheartened by the cost, because keep this in mind, right? That you're going to spend, if you get into a private college in India, it's a lot of money. It's a different matter if you get into a good government college. It is definitely cheaper to stay here. And if you can afford to study in St. John's today, you can afford to go to the US, right? What does a UG pay now when you join? What's the fee? Huh? 1.9 per term, 4 lakhs a year, right? I mean, all inclusive, hostel, blah blah blah, all put together 4 lakhs a year. So this is just another year, another year's fee. So if you are in John's today, you can afford to do this. So let's not pretend like people in John's can not afford this, right? And if a PG in John's is something that you're even thinking about and is like financially possible, then you can definitely go to the US. And residency programs pay well when you start, right? You earn between $40,000 and $50,000 a year to start with. It sounds like a lot of money when you convert, but in the US, it's definitely plenty to live on. Like, it's not like you'll have to get money from home. It's more than enough to survive quite comfortably. Okay. If you do take a loan, in all probability you'll be able to pay it off within a year, the amount that you earn, right? Visa issues, I don't know too much about visas, and I thought that by this point everyone would be sick of hearing me talk. So this is something that we can maybe discuss at a later date, or someone who's better versed with all this can talk to you all about it, right? Caribbean equation, this is something that a lot of people have been asking me of late. So does anybody know about these Caribbean medical schools?
First 2 years in the Caribbean, last 2 years in the US.
Yeah, so what they've done is that everybody wants to be a doctor even in the US, right? It's not only in India where people want to be a doctor or an engineer. So, and the seats, obviously the seats available are limited. So, you have a bunch of people that can't get into medical school in the US. So, what a group of what people did in the 70s was to go over to different islands in the Caribbean. So, I think the earliest one started in Grenada. They have schools in Antigua, in St. Kitts, so in different islands basically in the Caribbean. So they started these schools. They're all private. They're all for profit. Some of them are owned by big companies, and they charge exorbitant fees to medical students. So it's a bit like paying capitation fees, or it's a bit like being in a private medical school in India. It's not very different. And so US citizens go to these schools. They do their year 1 and year 2 in the Caribbean. So that's your anatomy, physiology, all that stuff. And when it comes to years 3 and 4, when you need your clinical rotations, they have tie-ups with hospitals in mainland US. Typically, a lot of them are in New York, New Jersey, some of them are in Michigan. So they have 2 or 3 states that are really heavy on this, and they pay these hospitals to take their students. The hospitals benefit too, and they like them. So what happens is they have these rotations, and they know, obviously they get to know people because they're rotating through these hospitals. They get good letters of recommendation, so they are at an advantage. And you're competing with them as an FMG because they're also foreign medical graduates, right? They've graduated from outside the country. Now, 25% of ECFMG certified physicians in 2009 were from institutes in the Caribbean. And 61 new medical schools have opened in the Caribbean in the last 10 years. Okay, so that's a lot of schools. And they've gone up from 1,500 to 4,000 in the last 10 years, the number of people graduating from these schools. So you are competing against them. So the competition is hard, and it's not, but it's absolutely, I mean, it's in no way undoable, right? If you ever get really disheartened by all this, just go to NRMP, download their, what they call, they release a bulletin every year called the outcomes of the match, right? So you download this and you just look at statistics. Statistics don't lie, right? You find out how many people have gotten in, what percentage, what scores, and you have all that data that tells you that if you do certain things right, there is a very, very good chance of making it. Does anyone have any questions? Yeah.
I read at a forum that IMGs can't get into the top fields like radiology or them.
Do you mind if I sit down?
No problem. Just pull up the chair.
Yeah, go ahead.
I read at a forum that IMGs can't really get into top branches like ophthalm, dermat,
Yeah.
neurology. Is that
For the most part, it's difficult to get in. So there are guys who get in. So I know a guy who's got in neurosurgery, which is probably the most competitive. So he did 2 years of research in a neurosurgery lab, published a whole bunch of papers, worked with a guy who was very, very well renowned in the field. And you can get in. I mean, there's nothing stopping you from getting in. There are guys who I know who've done dermatology. There are guys who I know who've done radiology. So it's not impossible, but again, it's difficult. And you can't just go in with a good score and expect to get into radiology. You need to be ready to invest time in doing research and some of the other things to get in.
Do publications which you get as a student here or as a PG here, do they carry the same weight as something for them there?
Depends on what journal you're
If it's an
publishing in.
indexed Indian journal,
Indexed Indian, if it's a peer-reviewed publication and they see that you've published something, it's definitely worth something. It may not be the same as being published in JAMA or Lancet or whatever, but it's definitely better than not having anything published. One good opportunity you all have is your community medicine projects, because you have to do that anyway, right? You're forced to do it. So if you can put in some effort, do that properly, try and gather data honestly, and do do a good job with that, many of those can be published. I think another place that you can do papers that are fairly easy is maybe anatomy, describing some kind of malformation in a cadaver. So that's another place that you can maybe get publication.
Another good place is super specialties, like pediatric surgery. For those fields have a lot of raw material which is there, and not many students approach those departments. So we'll pick up a lot more publication-worthy material from the super specialties. So.
What about case reports and that's it?
I mean, they count for something, but a case report really isn't. I'll tell you one thing. I did 4 months of research in Irvine in California, and so I think by sometime next year I should have about 6 or 7 papers published. I knew nothing about research when I went there. I am not good with research. I'm not all that interested in doing clinical research and outcomes research, but they have the machinery for research set up so well there. They have excellent electronic health records. They have, most people are consented for having their data used. You have statisticians, you have, I mean, it's much easier to publish there. So when you guys do go for your clerkships, or if you're going to spend time there for 2 or 3 months for whatever reason, try and make sure that you use that opportunity.
Earlier you had mentioned that the degree is accepted everywhere in the world. But then previously I read that you do this year, you go there, you get an MS degree. When you come back, the MCA doesn't recognize the MS, so you only get to work in private and you can't work in
so I think
college. So.
I think there's a problem. I don't think you can get into a central government institute and say become a professor. I think that's a problem. But I believe that there's some kind of legislation that's ongoing to change that. But I don't know the details. But that's a good point. I'll check on that.
Recently, there was also a report on a forum that the number of seats for AMGs have considerably risen because of Obamacare. Any word on that?
What do you mean by seats for AMG?
For AMGs, American Medical.
Yeah, I know, but what do you mean by seats for them?
The medical seats, the undergraduate seats.
You mean to have medical schools expanded?
Yeah.
Yeah, so a lot of this is based on this one JAMA article that came out some time ago about how medical school seats have really expanded and residency programs haven't kept pace, which is true to some extent. Medical schools have expanded, residency programs haven't expanded as rapidly. But it's still not, I mean, it hasn't changed the dynamic all that much. It has, but not to a degree where it makes it impossible for an FMG to get in. And Obamacare is going to need a lot more physicians, right? When Obamacare is implemented, an enormous segment of the American population is now going to have insurance and is going to need medical care. So they will need more physicians. The question is how are they going to get these physicians in? Because they only have a limited number of training programs. The reason they can't expand training programs is that your residency program is actually funded by the central government. So if you suppose I go to a particular hospital for a residency, I'm working at that hospital, right? But that hospital is not paying me. It's actually the government that's paying the hospital to pay me. So the US government doesn't have money, right? And they're not very sound financially, and it's difficult for them to expand these seats because each additional seat they have to pay for. So which is why it's a lot more difficult to expand residency seats as compared to undergraduate seats.
Does the bond actually help in this?
I mean, I'm really happy I did my bond. I can only tell you from what I know. I think I'm much more confident I feel like I'm a physician of some sort because I've done the bond. When I finished internship, I was an extremely efficient ward boy. Okay, that's what I was, and I don't think I had any kind of clinical experience. And you see a lot of people who go into MBBS, finish internship, go directly into their MD, finish their MD, go directly into their DM, they come out ready to practice endocrinology in an urban setting. And I think that really takes away from how much they can contribute and takes away from their training. I think if you actually go to a rural area, you spend some time, you see how different people live and how work is done in smaller centers, I think it helps you immensely as a person. It makes you a lot more confident. I think it makes you a lot more empathetic, and it goes. And people can see that. I think when you go there to start training, people can really see that you're a lot more mature in the way you handle situations, and I think you make a better person.
No, but does that help in you getting the thing? Is there any weightage?
It depends on what kind of story you have and how you can spin it. So a lot of it depends. On the interview they'll ask you, so what have you been doing the last 2 years? If you say I was 20 minutes outside Kottayam in a private practice clinic seeing patients from 1 p.m. to 4 p.m., it's going to count for nothing. But if you can say I went to Chhattisgarh or somewhere in Bihar and I was working in a really remote area and I saw this and I did this, then people are going to say, listen, this guy is committed and he's really done something useful in the last 2 years, so maybe that's worth something.
Some other guys sending in questions on the same topic. It says, do you think that they should first do the rural bond and then can you actually study during the bond? You have shown it, but can that happen to everybody?
Yeah, I mean, absolutely. Listen, anybody can do this, okay? It's not that difficult to study and do your bond. It's a question of whether just put your mind to it and you can do it. Bond is not that hard. Like you work 8 hours a day and you have 16 hours, right? You can spend a couple of those hours studying easily. And you needn't do it in 3 months. You can take 6 or 7 months to study for step 1 if you want to. Do it more slowly, there's no hurry. You're there for 2 years anyway, right? Doing your bond. So take your time, start studying as soon as you do your bond, do a little bit each day. And take 2 or 3 weeks off just before you give step 1. You can easily do it. There's absolutely no problem.
How did you get your no objection letter from the government?
I actually saw that question and I don't know the answer to it. So I'll find out and I'll, if you can
Have you got your letter?
No, I haven't.
What's the letter?
I don't know, I hadn't heard anything about this no objection letter.
Is
But,
it a visa? The visa thing?
Probably a visa question.
but I'll find out about this and email whoever sent that in.
Why do some Indian doctors choose to come back after some time? Is it patriotism or something more?
I mean, that's a vague question, right? Why does someone choose to come
No,
back?
but you're in a good position to answer because your parents came back.
Yeah, but they always want to come back. So I think if you're very clear that you want to work in a rural area or you want to, that's what you don't want to do in life and you're clear on that, then going to the US is just a step to getting somewhere, right? I think increasingly America isn't as easy a place to practice now as it was maybe 30 or 40 years ago. And I think India has a lot more opportunity than it did a few years ago, right? And the quality of life, I personally think that the quality of life in India is much, much higher. So I don't see myself being in the US permanently. You know, obviously this is when you're 26 and you haven't yet gone there and you're not yet earning big money, you can say all these things may change. I don't see myself doing that. And also I think working in India is a lot more rewarding. There are plenty of places in India where you can work that are, you really feel good about what you do. So.
How much does MBBS marks count? Agreed, they won't count as much as if you had studied in US, but do they really count for nothing, MBBS marks?
So it depends on whether they happen to take that particular page of your CV. They may completely ignore it. But some guy may flip through your CV and say, and look at your grades and say, oh, you did really well. And that means something if you've got a good step 1 and step 2 score. So then they'll say, this guy is showing some kind of consistency through his medical education, so maybe this one can. You know? So it definitely doesn't hurt, right, to do well. And it can only help, but it may not help all that much.
So what, Kaplan? Is that something which you would recommend or any other group?
Yeah, I mean, I use the Kaplan books. So I didn't go for the classes and stuff. I just stayed at home. I don't think you need to go for the classes. I think you can just study on your own with those videos and those books. So that's what I would recommend. And most people that I know who've done this have done Kaplan.
So the odds of getting psychiatry?
Psychiatry is relatively...
I'm just reading questions on WhatsApp which are coming. These are not my questions.
It's a bit of a career switch, I was wondering. So psychiatry is one of the less competitive fields. Psychiatry, family medicine, less competitive.
What exactly is this 5-year MD, PhD program?
So an MD, PhD program is actually something that medical students there do. So when a medical student finishes there, you get an MD. You don't have an MBBS degree, right? So some of them do an MD, PhD. They take the time off and do an MD, PhD. Or an MD, MPH, that's more common. You can also do a PhD during your residency. There are a lot of people that do a PhD during their residency. Come on, doing an MD, PhD.
For the ones who are closer to internship or just passed out, is doing step 2 CK first better than doing step 1?
I mean, there's no better or worse. There's no harm in doing it first. It's not like it matters when it comes to application when you did what exam. So whatever you feel more comfortable with. But yeah, I agree. As soon as I finished final year, I think if I had done step 2, I could have studied for it in a couple of weeks because the complexity of what you study for your Indian final year exam is much more than what you do for step 2. And you just need to, there are a few things that are different here and there. You just need to pick up those little differences and you'll be able to write it easily. But then when you finish final year, you're in no mood to sit for 2 weeks and study for another exam. So if you can do it at that point, yeah, I think it'll be really good.
Any more questions from the hall? Okay. There's still an opportunity to post questions online. I'll send it on the WhatsApp group so we can compile those questions and then trouble him once more. Like from Gudlu to give us all the answers together. So can we put our hands together for Gopal for a really comprehensive look at what he's done. He's doing this not just for us who are in the room. There are lots more Johnites who are outside who are going to benefit from this. And, I don't mean to send you all to the US. We're planning another one on the Indian exams next month. Right? And I also want you guys to just type in to me on that email ID or on WhatsApp as to what other topics you want covered, or not necessarily about leaving the country, or what specific fields you want somebody to come in. We are open, right? So we have not got a fixed calendar. I want to fill that calendar with what you guys need as the end users. Okay? Thank you, Gopal.
Thank you.
Fantastic.
Thank you guys for coming.
He came down from Gudlu just for this. Okay, so I think that's a really big thing. Thanks.